Government advisers predict 20,000 people will die with coronavirus in the UK, even with the social distancing and shielding of vulnerable groups. Analysis of the first 386 deaths in the UK has shown that 98% had underlying health conditions. The majority were elderly, with the oldest being 105. What we don't know for sure is how many died because of the virus. Every year, 600,000 people in the UK die. That's 1,644 deaths every day. And most of those would be elderly or in poor health. So there's an overlap between the background mortality and those dying during the epidemic. So let's take those 20,000 predicted deaths from coronavirus. Now, one of the government's key advisers hazarded a guess this week that between half and two-thirds of those dying would probably have done so soon anyway. So do the maths and deduct those from the predicted deaths, and you're left with somewhere between 6,667 and 10,000 deaths that can be attributed directly to the virus. Statisticians call those excess deaths, and by way of comparison, regular seasonal flu causes 8,000 excess deaths a year, so not dissimilar. There's no doubt that social distancing will save many lives, but the economic shutdown also has a human cost. The financial crash of 2008 resulted in unemployment increasing to 212 million across the world. The resulting poverty and poor health caused an estimated 260,000 additional cancer deaths and 10,000 additional suicides. Now, every death is, of course, a tragedy, and right now we're staying at home to prevent the NHS from being catastrophically overwhelmed by the virus. But once we're over the peak and cases begin to fall, the government will have to balance the lives saved through social distancing with the lives lost by prolonging the economic pain.